Hi guys, Dayman Max 6 and we are back with Dr. Rand for a new segment of Ask the Doc. And we've been really good about putting out the video on time. So I'm out of material, so we're back in the doc's office and we're going to get rolling right away with question number one, Doc. This guy says, I was a huge bodybuilder during my 20s, 30s, and early 40s. I've smartened up and been off for a few years. Is it possible to be somewhat close to the same look but more monitored by Dr. Rand? Well, I guess what I'm trying to say is I want to go see the doc and get on hormone therapy, but not just to be normal in size, but to look somewhat close the way I was back in the day. Not Mr. Olympia size, but decent size. And my second question is it is it paid by credit card or does he take insurance? If insurance, which does he take?
Cool question. All these questions end up being cool for some reason or another. I don't know, you say huge bodybuilder, meaning you've been huge before, or a huge fan, or someone who worked out a lot. I don't know. Either way, it's good for this particular gentleman, because I found the analogy I use is like a balloon. If you've blown up a balloon once, it's so much easier to blow it up again the second time, right? So I know he doesn't want to become gigantic necessarily again, but if you have been, let's say, 250 pounds at 6 foot, let's say, and now you're sitting at 185, well then yeah, it's a heck of a lot easier to get to really even 250 pounds again if you've been there before, but certainly a lot easier to get to 225. And I don't know if these numbers fit into his numbers, but the answer to the question is a resounding yes. You can always, I find, get back to where you've been before, and it doesn't have to include steroids. It's just a matter of the same things that always count. You have to eat right, sleep right, and train right. Again, with steroids, you can go supra-physiologic, and you can leverage all those three things that we need to do properly anyway. But yeah, you see plenty of guys out there. I mean, you just go into Gold's Gym and you see guys that aren't has-beens. I don't mean it that way at all, but they've gone through their day. And he says, smartened up. I assume he means, hey, you're not trying to be a champion. I don't mean to say that either. We always want to be a champion, but you don't want to hold champion status, be the number one or the number one contender for a number of years. That doesn't play out well. We found that over the years. I mean, look at all the people who have tried to stay in the Olympics and are dead. Versus the guys that come in, you give your best shot and get out. So if he means smart by that, then yeah, definitely you smarten up in a good way. But yeah, we can always maintain an above average muscle mass, and that's not a loaded statement either. And you look around, average isn't all that great, but yeah, I mean, I hope that answers the question. As far as the other one goes, no, we don't deal with insurance. It's a total ripoff, the insurance game, as you know, and hopefully the whole system will fall apart and we can get some real medicine going out there. But we can. What we do here is we give it's called a super bill, a CMS 1500, to the patient. They can beat up their insurance company to get whatever they can out of it. I'm sorry, it's just I can't spend the time that I need to spend with people. The 3 to 5 minutes they spend in H-emojis and cutting the mustard. So they don't reimburse that much at all anyway. Certainly I could make a living that way. So I apologize for that, but I'm happy to keep answering questions, the way we're doing it here for as long as possible.
I'm sure you appreciate it. Thanks, Doc. Okay. An older gentleman. I know what you're gonna say next.
You better not. You better watch the age
I'm a
you use.
50-year-old male, down about 30 pounds with another 40 to go to get to a healthy BMI. My endo has me on 600 milligrams of test cypionate per week and anastrozole to maintain muscle mass. He doesn't mention how much anastrozole or to maintain muscle mass. It has worked wonderfully. Recently, I've hit a plateau. My question is the body weight set point related only to body fat, or is it total body weight, muscle, and fat? More specifically, if I increase muscle mass using anabolics, will fat decrease proportionally to maintain body weight set point? If you have any tips on fat loss and physiological dose of testosterone, please throw them in. Thanks, Docs and Dave, for this resource. You seem to be the sole provider of scientifically sound information on topic related to steroid use.
I wish I could give. I definitely want to give a great answer here. I just not sure I have enough information. Obviously, it sounds like this gentleman has lost a great deal of fat.
Mm-hmm. And still has more to go.
There may be some muscle loss with that, but that's and that's a a lot of mass, whether it's muscle or fat, to lose all at once. And I know it wasn't all at once, but fairly quickly, it sounds like. Is there a set point? Is one of his questions. Yes, there is, in the sense that we're born with a certain number of cells, fat cells, and the current theory now is that you're not really getting rid of fat cells so much as you're shrinking them. Right. So just like people can tend toward being an endomorph or an ectomorph or a mesomorph, you have a window within which you can work, but you're only going to get to the edges one way or the other. You're not going to climb outside that window. An endomorph is never going to look like an ectomorph. I mean, you got certain cards you got to play and you're dealt. That having been said, for what most people want, no, there are no limits. I mean, again, you're not going to look like a string bean if you're an endomorph, but you can get rid of your fat and be, a nice, healthy, super healthy 8% body fat. So, on the one hand, I want to be realistic, but on the other, I definitely want to be totally motivational and optimistic. I mean, there are no excuses, I guess, is the bad news. The good news is you can get whatever you want, Mm-hmm. In some ways, it might be more difficult, certainly, to lose fat if you're a natural endomorph. And it's just a body type where you tend to be, endomorphs are the guys that tend to be, big boned, as they say, and have a more difficult time losing fat, but can put on muscle, just like a mesomorph. Ectomorph's the opposite end of the spectrum, where he's naturally very, very thin. It's all he can do to put on, any muscle. He misses a meal, he drops, this is me, by the way, drops 5 pounds and can generally stay pretty lean no matter what he does or eats. So I would stay definitely positive. And, we did talk about earlier in this discussion a bit about, set points when it comes to testosterone levels, but really when it comes to, body weight, if you've been there before. Mm-hmm. We talked about that earlier. If you've already been to a certain level of muscle mass, you can get there much easier. It's been my experience. I'm not sure if we have any studies on this, but I have no doubt, or I wouldn't be opening up my mouth about mm-hmm. it. But if he has been thinner before, which naturally he has, then he should be able to get there. And of course, what he's doing through an endocrinologist, which is great. The dose of 600 milligrams per milliliter of testosterone cypionate, as we mentioned earlier, is probably max dose per the studies, mm-hmm. before which you start having things go south on you, no matter what you do. And you're actually, though, bigger, stronger, faster, healthier with that dose. Again, I'm surprised, because I don't see that adopted, by really anybody that I know of. That's the first I've heard of an endocrinologist prescribing that amount, even though we do have some of those rare studies. Like I said, I just never thought it was going to be adopted by, certainly not the AMA in my lifetime anyway. So it's great to see that that's happening. One thing you might want to be careful of and look out for is with a dose like that, make sure you're covering your estrogen a lot. Again, you've got to be super saturating the androgen receptors. So make sure that extra testosterone is not floating around and helping you promote fat gain by having elevated levels of estrogen. That would be,
Yeah, he says he's on an estradiol, so you just got to make sure he's
getting an
adequate amount.
Yeah. That's a lot to cover, and you might have to switch to, again, who knows? I've seen patients with 1 cc a week. It's not often. 1 cc a week of testosterone cypionate, they need letrozole, because sometimes they're, for example, I haven't developed a rapport enough, or they just don't care what I have to say about maybe drinking too much, because that can raise your levels of aromatase, or again, just genetics. Mm-hmm. Maybe they have a lot of aromatase and they make a lot of estrogen. Yeah. So that you got to make sure is covered. I wouldn't necessarily go above that dose. We talk about this stuff in our videos all the time. You get to a certain point where testosterone may not be the best answer. Mm-hmm. I would suggest you talk to his endocrinologist about ways to improve deposition of muscle mass by maybe backing down on the testosterone and going to an anabolic and say, hey, what do you think about maybe cutting out half that testosterone, but let's get something which is going to really leverage that muscle mass, some oxandrolone, like we talked about earlier. Maybe 20 milligrams a day of that, and see if that doesn't make a big difference, especially since he's hit a plateau. And assuming, of course, that he's doing all the right things, which, come on, man, if you drop 40 pounds of fat, you've got to be doing something right. So he's probably eating right, sleeping right, and
But
training.
the problem is that when you have that much weight to lose, also, you know, like I do, that the first few pounds will come off much easier.
Sure.
After a while, it's just the body doesn't want to let go anymore. You know, it stagnates. So yeah.
Well, that's pretty much the cost of victory, or what happens, you know, in a nutshell. I mean, it's that last 5%, 1% that makes the difference between the champs and not, right?
Yeah.
But to your point, yeah, I mean, you're going to see a lot in the beginning. But you know what? Also, though, what I've seen, particularly with weight loss, if it comes what I would consider the right way with muscle gain, you get a snowball effect. Because why? You're putting on muscle mass, which is synonymous with metabolism, right? So you get some headway going, and you go, wow, now, you know, and you start to really see it start to drop off at the end. Now, again, that last percentage where all of a sudden you can start seeing, you know, abdominal muscles and cross striations, maybe even, you know, that part is, you know, that's why you don't see a whole lot of it. It ain't easy to get to that point because it's not natural for the body, I think, is the main reason.
Yeah.
But just to get to a healthy, like we said, you know, 8 to 12%. Yeah, I mean, he should definitely be able to get there.
Yeah.
So we answered the part about what to do with super physiologic dosage. Watch your estrogen and maybe consider, you know, an alternative through his endocrinologist. And no, there's, you know, no excuses, man. You can definitely get there. I guess is the take home. Yeah,
There's no
you're not stuck. Yeah, you can get all. You can make it all the way.
That's awesome. Thanks, man.